What effect does caffeine have on depression? In this video, we will tell you both the positive and negative effects of caffeine in people with depression. Scientific studies into the relationship between caffeine and depression have shown that caffeine can reduce the incidence of depression. A study that took place in China found that caffeine contributed to a decrease in a person's risk of depression. More studies looked at the relationship between caffeine and depression. They concluded that caffeine, when present in coffee, had a protective effect against depression. They also revealed that tea was less protective than coffee but still effective in reducing depression risk to some level. Another study found that drinking 1 to 4 cups of coffee per day reduced the risk of suicidal thoughts in women. So why is coffee better at reducing depression risk than tea? According to one Japanese study, some components in coffee might reduce the negative effects of depression. Coffee also contains chlorogenic acid, ferulic acid, and caffeic acid. These acids can reduce the inflammation of nerve cells that take place in the brains of the people with depression. This may relieve some of the discomfort and distress that depression can bring. The study also identified that green tea has a high antioxidant content and can be as effective as coffee in protecting against depression. Green tea contains folate, which may also help with the depression. But not all studies agree that caffeine only has positive effects for people with depression. There could be negative effects as well. A study of how nutrition can affect depression in adolescents suggests that tea and coffee might disturb the important neurotransmitters including dopamine and gamma-aminobutyric acid. Shortage or disruption to dopamine in people with depression can cause low motivation and a craving for drugs and alcohol. Heavy coffee consumption and a high intake of caffeine can result in side effects such as anxiety, headaches, increased blood pressure, nervousness, sleeplessness. All of these symptoms can have a negative impact on mood. Several studies have also shown a link between coffee intake and an increase in depression. Caffeine consumption could make depression worse in people who already have mood disorders. This happens because caffeine is a stimulant. Caffeine only provides a temporary boost to the nervous system. As a result, people with depression may experience a more severe drop in their mood once the effect of the caffeine disappears. So people with depression should only consume caffeine in moderation. Thanks for watching the video. Don't forget to subscribe the channel for more interesting videos.